Good morning, esteemed judge. I'm Adin, final year MBBS, and I'll be presenting to you on the topic Coronavirus Disease 2019, that is COVID-19. So to begin, COVID-19 is an infectious disease caused by the virus SARS-CoV-2, that is Severe Acute Respiratory Distress Syndrome, Coronavirus 2. And this was first identified in Wuhan, China back in December 2019, and its origin was linked to bats, following which it became the third documented animal spillover of coronavirus to humans after SARS 2002 and MERS, that is Middle East Respiratory Syndrome, 2012. As of June 5, 2020, there are around 6.64 million cases globally from 188 countries and around 2.4 lakh cases in India. Moving on to the pathophysiology, as you can see here, the main mode of transmission is through respiratory droplets and fecal shedding by patients, that is the environmental contamination. And this risk of transmission is seen both in the symptomatic as well as the asymptomatic phases. And so, the main organ involved is the lungs because of the presence of ACE2, that is angiotensin converting enzyme 2, which is abundantly present in type 2 alveolar cells. And so the virus hosts itself onto the enzyme with the help of a specialized surface glycoprotein known as spike, which is a peplomer, goes to the lungs, it multiplies, and spreads to the cardiovascular system, giving rise to systemic inflammatory response syndrome and multi-organ failure. And so it also spreads to the central nervous system, giving rise to fever. And the hallmark of the disease is lymphopenia, which is reduced CD4 and CD8 T cells, which is actually a poor prognostic marker. On histology of this severe disease, we can see something called diffuse alveolar damage, which is typical of acute respiratory distress syndrome, wherein there is cellular fibromyxoid exudates, formation of pneumocytes, as well as formation of the hyaline membrane. Moving on to the clinical features, the incubation period of the disease is around 2 to 14 days, following which signs and symptoms, which most commonly include fever, followed by dry cough and fatigue, which followed by muscle pain, sore throat, shortness of breath, as well as headache. And the complications include pneumonia, ARDS, that is acute respiratory distress syndrome. We also have multi-organ failure, shock, and death. And the threat is higher in case of those above the age of 60 and those who have comorbid conditions such as hypertension, diabetes mellitus, and cardiovascular diseases. And the age distribution is around 87% in those between the age of 30 to 79 years, and the mortality rate is around 2 to 4%. Moving on to the diagnosis of the disease, the CDC, that is the Center for Disease Control and Prevention, has recommended both upper respiratory tract and lower respiratory tract specimens, which include nasopharyngeal swab, oropharyngeal swab, and sputum, which are to be collected in sterile separate containers containing 2 to 3 ml of viral transport media and to be refrigerated in 2 to 8 degrees Celsius. Now, the CDC has also recommended that the standard diagnostic measure to be real-time reverse transcriptase polymerase chain reaction, that is RT-PCR, for easy and accessible diagnosis for the disease, and serological techniques to detect IgG and IgM antibodies to be preserved strictly only for epidemiological and surveillance purposes. And the lab markers which can predict severe disease include increased neutrophil count, increased bilirubin, increased liver enzymes such as ALT, AST, and increased creatinine, as well as elevated procalcitonin, which is actually important because it is seen to be elevated in patients who are admitted in the ICU due to bacterial superinfection. Other markers include decreased albumin and decreased lymphocytes, lymphopenia being the hallmark of the disease. And on CT chest, as you can see here, there is bilateral multilobar ground glass-like opacities, which is distributed more in the periphery, a little posterior, and asymmetric in nature. Moving on to the prevention and management, the CDC also recommends prevention by following measures such as washing hands with plenty of soap and water for at least 20 seconds, maintaining social distancing for at least 2 meters or 6 feet, to stay at home to avoid crowded places, and to avoid touching the eyes, nose, or mouth. And also there should be investment in lab measures and emergency plans. And the mainstay of management is by supportive care, that is by IV fluids and oxygen therapy, and monitoring the vital organs. As of now, there is no vaccine or medical treatment recommended or accepted for treatment of the disease. There are certain vaccines under trial by various agencies, and certain drugs also are being implemented as well as under trials such as hydroxychloroquine, which is shown to be effective against cytokine storm. And another antiviral drug is remdesivir, which also shows promise. And so moving on, these are my references. And so I'd like to conclude by saying that right now the most important measure that we should follow is prevention. And so we should make sure that we wash our hands every day with plenty of soap and water. So stay home, stay safe. Thank you.